first. You heard the health minister there. She seems to suggest all is under control. We were prolonging the wave. That's all that's happening. Our fatality rates are low. Our testing is high. Do you think she's right?
I think on some parts, there is certainly a need to worry. For example, test positivity in excess of 10% is not a good situation to be in at any point. But on the other hand, there are some positives. The case fatalities are still below the average for India over a longish period, although they're slowly creeping up. That's a positive. We're not seeing an overwhelming of medical infrastructure, of health infrastructure so far. Still, there are empty ICU beds, there are empty oxygen beds, etc. So I think Kerala is in a unique position because it has the lowest seropositivity of any of the states of India. So there are many people to be infected. And this is a delicate time for it. I suspect that they will be able to control this. They're doing all the right things. They're vaccinating at a large fraction. They're testing well. I suspect overall I'd be positive, but I would be very watchful over the next few weeks.
You said the one worry is that test positivity ratio remains between 10% to 12%. Now WHO wants, believe that it must be below 5. Why do you think Kerala's test positivity ratio is so high? It cannot be just because of high testing. Is it the serological survey that not enough people there have antibodies?
So certainly there are people to infect, which is one reason why the disease is spreading. The other thing is probably because of not enough attention to how they opened up. At least from what I hear from Kerala, there have been instances of fair amount of crowding in shops, and shops have been open for smaller periods in the day rather than for long periods. It's usually a good idea to ensure that any crowding is really controlled, and if necessary, have shops open for a longer period so that fewer people can be there in those shops at a given time. I suspect this, a combination of the opening up for the religious festival that you mentioned, all of this together contributes to maintaining a high TPR. But on the other hand, it's still a sort of point in Kerala's favor that this has not not led to health infrastructure being overwhelmed.
That's interesting. Dr. Anish, the glass can be half full, half empty at the moment. Do you see, Dr. Anish, the glass is in Kerala still as half full? Or do you believe the last month has led to serious concerns over containment strategies?
Before answering that question, I want to say something that as Kerala's position is very unique. Sometimes Kerala may be right, sometimes the rest of India is right. So the real question is something like that. And you look at the seroprevalence rate, you can see that Kerala's seroprevalence is lowest in the country. Is it because of lack of vaccination or is it because of lesser infection? It is not because of lack of vaccination, because Kerala vaccinated much more compared to an average Indian state. Mm-hmm. And it is actually among the big states, it has got one of the maximum vaccinated communities, Kerala's community. Then that means the real infection that was happened in Kerala is much less. Was it a success in a fight for COVID, or is it a failure? Do you think Kerala's containment strategies were not work? If it is not work, why this much less percentage of this seroconversion or this much seroprevalence? So Kerala's containment has worked well, and even Google mobility data is also showing that Kerala is the place where the containment strategies work well. It is actually because of the containment strategies work well, we are getting more number of cases now because we have got a very large amount of susceptible population.
No, that's precisely it. You're a victim. You're a victim of your own success. You're a victim of your own success in the first wave. But you needed possibly a different strategy for the second wave. You needed a different strategy maybe in the last 1 month in particular.
Okay, please just hear me what I want to say. We are not victim of our success because the number now is different from the number that we would have experienced in April or May. Because now almost 50% of our population is at least one dose of vaccination, and a lot of breakthrough infections are there. Our elderly people and people with comorbidities are completely protected by vaccination, and now the disease is happening to younger age groups, and we have got enough beds in our hospital. Mm-hmm. So how can we prevent? How can we get that kind of a herd immunity threshold that is almost equal to 65% that in India's the other states have? What is the gap is 21%. How we can build that 21% gap? Either we have to vaccinate more, or
Or you have to stop prolonging the lockdowns. You see, in a way, maybe the second wave does not require these kind of harsh lockdowns. Let me take that to let me take that to Dr. Lal, because Dr. Lal has been among the critics of that. Dr. Lal, do you believe that Kerala needs to now start because otherwise the serological survey numbers show this wide gap. Kerala well below the national average in terms of antibodies. It's a dilemma for different states. How much do you open up?
Yeah, see, there are a lot of other things to be discussed, basic things. You said we are victim of our own success. I would say we are in the prison of our own image. So Kerala has its own image, and we are trying to hide many of the facts, and we are trying to not look at many of the facts. So simple arithmetic, I'll tell you. See, before the elections, we were doing hardly 50,000 tests per day. Mm-hmm. There were political reasons also, mostly political reasons. And now we are doing close to 200,000, 2 lakh tests per day. So when there are more tests, there will be more more cases detected. That's very commonsensical. Mm-hmm. Then when you do more tests, the test positivity should come down, which is not happening because there is increased transmission. Transmission is at a very high rate. So there are alarming things to be concerned about. And I would say things are not under control. The problem is that we don't know exactly what is happening.
No, why is the transmission? Why do you think transmission has increased suddenly?
See, there were so many reasons. That's why there are other issues. It's not just Bakrid or whatever. See, we had our local body selections many months ago. We told, including Indian Medical Association, told the government to postpone it so that it can be together with the assembly election. Government did not listen because government knew that they will have majority in the local body election. They want to leverage out of that election. So they did that election. So many months ago, the entire people were out doing demonstrations, and when we had high levels of COVID, and all parties were there. Then came this assembly election. So 2 elections in a span of few months. That actually the entire. See, I'll give you another example. And you were mentioning about Onam. Last year Onam, 1 year ago, the institution where I am working as a professor, we did a study. 95% of Keralites were wearing masks. When people are told something, people listen to what governments say, because we are very literate, educated, and we are very aware of health. And so this is how society reacts. Then came, everyone was on the road shows and things like that. 2 elections, we lost complete control. And what happens is actually, Kerala government, that's what I'm worried about. The new ministry is also doing a lot of things. She is trying to rectify some of the previous mistakes. But the previous ministry had done a lot of mistakes. They tried to hide everything. There's a big issue in Kerala.
What is the biggest mistake? What is the biggest mistake you think Kerala has made, Dr. Lal?
We did not do enough number of tests. Dr. Anish also knows. We were demanding for at least 100,000 tests per day. Even the chief minister said we should be doing 100,000 tests per day. Because it was election, they kept it around 50,000, which means we did not detect many cases. Those people were walking around and spreading the disease.
So you believe
that's one thing.
Yes. You believe that election period turned out to be a critical period. What's the other big issue?
Then came both the elections. Then people were, Kerala is a very crowded place, very highly densely populated place. And we are a mobile population. We move everywhere, and plus elections. So every person was mobile in this state. So which makes Kerala fertile land